So, hello and welcome to this week's Health Careers in Focus. My name's Abby. I'm from the BLMK Health and Care Academy. Today I am joined by Sarah and Chloe, who are dietitians, and I will hand over to them.
Hi everybody, I'm Sarah. I am a paediatric dietitian working at Luton and Dunstable Hospital NHS Trust. Okay, so I want to tell you a little bit about my career journey. I haven't always been a dietitian. I knew that I always wanted to work with children. I knew that when I was at school. So after school, I initially trained as a nursery nurse back in the 1980s, quite a long time ago. And I didn't really know what I wanted to do, but a job came up in London. I come from the Midlands, as a children's nanny. So I decided that I would go for that job, and I got it. So I moved down to London in the late 1980s and became a children's nanny for many years. I mainly looked after infants, so 0 to 2 years. But I felt after a few years that I wanted a new challenge. Wasn't really sure what I wanted to do, but knew I wanted to continue to work with children. Thought about what it was in my current role that I really liked doing, and decided that actually what I really liked doing was nutrition. I loved the infant feeding, the weaning, getting babies onto solid food. I loved planning meals for toddlers, cooking. So I really liked that aspect and decided that I wanted to become a dietitian. So while I was still working, I completed an access course to get my biology and chemistry qualifications and applied to university. I did my undergraduate degree in nutrition and dietetics in 2002. It's a 4-year degree, and qualified in 2006. And then I looked for work for positions in hospitals as a dietitian, and wanted to stay in London, but actually a job came up in Luton that had paediatrics in the role. I got very excited about that. So the job was a combination of adult services and paediatrics. Went for the job, and I think they could see that I was really quite passionate about paediatrics, and got the job. So I started working in Luton in 2007. I think quite quickly a specialist paediatric job came up, probably only about 6 months after I'd started, and I went for that and got that job. So then I started working as a specialist dietitian at Luton, and did that for many years until another job came up for a band 7 specialist paediatric dietitian. They included a team leader role. So I went for that and got that job, and that's really where I've been working until 2024, when another job came up on our neonatal unit as a result of funding for allied health professionals. So I went for that, deciding that I wanted to specialise even further within paediatrics, and got that job. And so now I'm a specialist neonatal dietitian on our neonatal unit in Luton. So what does my day look like? Well, I work as part of a very large team on a level 3 unit in Luton. And what this means is a level 3 unit is a unit that takes the sickest of the preterm infants in our area. Now, I work in a network across the east of England. So this is the area that we cover in our network, and there's 2 other level 3 units, one in Cambridge and one in Norfolk and Norwich. So together we take the sickest infants. So yes, we see a lot of very complex infants on our unit. So my day starts quite early, and it starts on a nutrition ward round with the team. So because our infants are born very, very early, they're not able to tolerate nutrition directly into their tummies. So they're fed via a drip, a specialist intravenous nutrition directly into their vein. And so this requires really careful planning and calculation and daily review. So I work with a pharmacist and a consultant to review these babies quite early in the morning. The reason we do it early in the morning is because once that prescription has been finalised, it needs to go down to pharmacy and needs to be made. Then I might join the handover. So each day, the night team on the unit will hand over to the day team, and I quite like to be a part of that so that I can get updates on some of the babies and get to know what's happening to them medically, and that guides me when I'm planning my nutrition. And then after the handover, I sometimes attend the ward round. So maybe I've got questions after the handover and I want to talk to the team about a baby whose maybe medical situation has changed overnight, and that might impact on how we feed them. So sometimes I attend the ward round so that we can discuss as a team what we might do with the feeds. And then after ward round, there's always going to be writing up of what I've done that day, that morning. So I'll fill in all my dietetic records after ward round. And then in the afternoon, this could be a variety of things. So I might be doing an individual dietetic assessment. Maybe we've got a very complex baby and I'm having to do a more detailed assessment and plan of their nutrition. I might be doing some service development projects. I might be trying to develop resources for the ward or writing guidelines. Sometimes we have network guidelines that we need to implement, to put into place. So I would be in charge of doing that for nutrition. I do a lot of teaching about nutrition for our unit here. So I teach the nursing staff, the doctors, but I also do teaching at Bedford University on neonatal nutrition. I might be in an outpatient clinic. So sometimes if I'm not on a ward round, I might be in clinic reviewing patients that have been discharged from our neonatal unit that still need dietetic follow-up. I might be in a meeting planning an infant's discharge home. Some of our complex infants require quite careful planning to get them home. Or I might be just doing my management duties. So I might be doing something related to managing the team or some service development projects for our team. So there are many rewards and a few challenges to my role. As I've said before, one of the rewards for me is that no day is ever the same. I might plan what I want to do in the day, but actually when I get to work, the situation changes and often changes throughout the day. And I like that. I like to be constantly challenged and to review what my priorities are for that day. I'm very lucky to work as part of a really big team, and I absolutely love working with lots of different health professionals. I learn so much from the doctors, from the nurses, from my other colleagues, and I really like the fact that we work together to manage these very, very complex sick infants to improve their short-term survival and their long-term outcome. But ultimately, what I really like doing is making a difference to these infants. So as I've just said, actually they are so vulnerable when they're born, and they need to survive their inpatient journey. And what I do in terms of their nutrition can help improve their long-term outcome. So it's an absolute privilege to be part of their journey and to be a part of the journey the family has as well, and making a difference there. So that's really why I do what I do. However, we do have some challenges. One of the things I find quite difficult is that each week there is a different doctor, a different team of doctors, a different consultant, and each day there's a different nurse. And that can be quite difficult when the plans change, the situation change, they're managed differently, these infants. And I feel like I am sometimes the only consistent part of that team. But then you can turn that around and make that a positive, because I am providing consistency and continuity of care. So actually I can be on the ward round to say to a doctor, this is what we did last week and this is why we did it. So I know you're questioning this now, but this is why we did it. And sometimes that can help with just maintaining that continuity of care. It's also really important for our families as well. And sometimes on ward round, without meaning to, doctors talk in a language that maybe families don't quite understand. And if I'm on the ward talking about nutrition, sometimes I can just explain those things to families. And I think that's really, really important. And I see that, as quite a big part of my job. I'm constantly trying to raise the profile of dietitians and just raise the profile of nutrition. When these infants are born, they're very sick, and there's lots of machines looking at what their breathing is doing, what their hearts are doing. There isn't anything that tells them about the nutrition that we're giving. There isn't anything that tells them if they're not getting enough or they're not growing very well. So I sort of think that it's actually invisible. So part of my job is to just emphasize that on a daily basis, what the importance of nutrition is and how this affects survival of these babies, but also their long-term outcome. And I will keep talking about long-term outcome. It's a busy unit. And I am the only dietitian generally covering the unit. So when I'm on annual leave, or if I'm sick, or if I'm off-site for any reason, it's quite difficult to make sure that all the babies are getting what they need. So that's quite difficult. But I try to put plans into place for babies. This is where a lot of the teaching comes in, to make sure that the team knows what they should be doing. And occasionally we can have quite challenging conversations with members of the team. We have differences of opinions, and so I have to use quite effective communication skills to put my point across as to why I think a feed might need to go a different way, or to emphasize that we're not giving what we think we're giving to an infant. And I have to sometimes provide the evidence or the rationale for what I'm doing. So sometimes we have to have challenging conversations, but that's fine. That's, again, part of the job. So what would I say to my younger self? So being a mature student that went to university, there's quite a lot that I would say to myself, actually. So one of the things that I did as a mature student was to really make the most of my university degree and all the practical training that I had. I put my hand up to every opportunity. I volunteered for everything on my practical training, because I knew that I would get more experience in lots of different things, and this would help me in my future career and when I was looking for a job. I also think it's really important to consider everything you've done in your life aside from the academic side. So all life experiences allow us to acquire different skills, and I think those skills can be transferable. So I had I think quite a lot of skills that I could use at university, in my training, and then in my career, that I acquired outside of all of those places, but they're still really, really important. It's really important to remember that whatever you decide to do, there's sometimes a different pathway into that career. So for example, with dietetics, you can do A-levels and you can do an undergraduate degree, or you might choose a degree and then decide that actually, oh, I don't want to do this, I want to do dietetics. And if you've done a science degree, it could be that you could do a postgraduate degree. Or now you can do an apprenticeship. So we've got an apprentice coming up, and that's another way that you can get into dietetics. And I think I spent a lot of time when I was younger comparing myself to my peers, thinking about what they were doing, what they were achieving, and feeling bad if I wasn't achieving the same. Everybody's different. Everybody has a different journey. You're unique. Okay, so now I'm going to just go through a typical baby that I might see on our neonatal unit. So I've named this baby G. It's a little boy that was born very, very early. He was born at 28 weeks and 6 days gestation. And what that means is that he was born 12 weeks earlier than he should have been. So a complete pregnancy would last for 40 weeks. So any infant that's born 37 weeks or below is classed as a premature infant. And we usually find that an infant that had gone to complete pregnancy, so 40 weeks, would weigh about 3 kilos, give or take. This little baby G was born at 715 grams, so way less than a kilo. He was born very, very small. He was born very, very vulnerable and sick. He was also born with a heart conditioning which needed medical treatment, and his lungs weren't developed properly, which meant that he needed support with his breathing. So he had support with breathing via a machine. He also had underdeveloped bones. So we needed to support that growth and development of his bones with extra medication. So just to put all of this into context, I'd like to talk about what the significance of being born early is. Does it matter if an infant is born less than 37 weeks gestation? What impact does that have on his survival, on his long-term outcome? We can divide pregnancy into 3 stages: first, second, and third stage, or final stage. So this third stage of pregnancy, or the final stage of pregnancy, an awful lot happens. So this is a really critical period when the infant undergoes a lot of growth and development. So their brains grow rapidly during that third stage of pregnancy, and their organs grow and develop. So in particular, their guts and their lungs. And this is also a period when they lay down stores of muscle tissue, of fat, and they lay down stores of vitamins and minerals as well. So this is a really critical time for our infants. And when they miss this last stage of pregnancy, they're born with very limited stores. They're born with very immature organs, and they're born at a time where they're missing out on that brain growth. And what that means is that they have very, very high requirements in order to meet the needs to grow and development. So they have a very challenging time ahead. So what did we do with baby G? So as I've said before, these infants have very immature guts, and they're not able to have nutrition directly into their tummies. So we give them a special intravenous nutrition via a drip directly into their vein. And we start this on day 1 of life. It's really important because they have such little reserve that we give them nutrition within the first 8 hours of life to improve their chances of survival. So he had this special nutrition from day 1, and we built that up over 3 days. And so by the 3rd day, he was meeting his requirements that he needed to grow and development. It's also really important that even though they can't have their main source of nutrition into their tummy, we give them a really small amount of nutrition. And what that does is help to prime their guts. It helps to it helps to grow their guts and to mature. So the gold standard of any feed that we give to a preterm infant is always going to be mum's own milk or breast milk. So we support our mums in expressing a small amount of milk, and we give that on day 1. Often it's only 1 ml over the course of an hour, so really tiny amounts. So you may find that a little one only has 24 ml in 24-hour period, and we give that alongside the intravenous nutrition. And then over the next 20 days, we slowly decreased the amount of intravenous nutrition baby G was getting, and we increased the amount of mum's milk he was getting as his gut was starting to grow and develop. So the overall aim is to completely wean off intravenous nutrition onto milk feeds. And he achieved this by day 22. So by day 22, baby G achieved full volume of mum's milk. However, we're still not able to give this orally. So when they're born very small, they're born not able to suck or swallow. So we have to give mum's milk via a special feeding tube that goes into their tummy. So they get the nutrition into the tummy, but via a tube. And usually at this point, I know that he's been meeting requirements with his intravenous nutrition. So now I carry out a comprehensive nutrition assessment to see where we are, with what we're giving him. Are we giving him what he needs? Is he growing appropriately? So I do my assessment, and I can see that actually his growth isn't as good as we would like it to be. And when I calculate what's in his feed, he's not quite meeting his nutritional requirements. So what we do is we add in a special powder to mum's milk. And this adds in calories, it adds in protein for growth, and it adds in vitamins, minerals, and salts as well. So it's a tiny amount of powder that we add to mum's milk. And when I do the calculations again, having added the powder, he's starting to meet his requirements. So I thought I'd talk a little bit about how we assess our infants. And this is a really big part of my assessment. This is a growth chart. So this basically describes how our infants should grow. And it's a series, you can see there's a series of lines for weight, for head, and for length. Now we call these lines centiles. And what we do is we plot each measurement that we take for weight, for head, and for length, and we plot them on these lines. So we weigh the babies every day, and I generally plot once a week. We also measure their head circumference, and that's the line that you see for head. And what that tells us is it's an indicator for how their brains are growing. So that's really important for us to measure. And then we also measure how long they are. So what is their length? And that tells us about their skeletal growth, how they're actually growing, not just gaining weight. So all three measurements are really, really important. And in an ideal world, we want them to follow the line that they were born on, but often that doesn't happen. Or it could be that actually if growth was restricted in the womb, we should ignore what they were born on, and we want to just see an improvement on that centile. So you can see if we look at weight, that weight dropped a little bit, and that was around the time that we got onto full breast milk feeds for baby G, and before we started the fortifier. But once we started the fortifier, you can see that actually his weight started to improve, and he started to climb in centile position, so that he was back to his birth centile. And you can see the same for head as well. So initially he went down on his centiles for his head circumference, but is now starting to go up. Length is really difficult to measure. So it sometimes is a bit difficult to interpret the length centile, but there is some improvement in that as well. So this is a really important part of my assessment, but other things that I would look at to assess is blood results. So when we look at the blood results, a lot of the results can tell us just about the nutrition that we're giving and what the stores are like for the infant. So I couldn't really do what I do without a big team around me, and everything I do is multidisciplinary. So the ward rounds, there's lots of people on the ward rounds. There's the nurses and a variety of doctors that I work with to make sure that we're looking at every aspect of care for these babies. I work very closely with an infant feeding coordinator, and their job is to support mums with establishing a supply of milk when we're giving it via tube. And then when they're able to have nutrition orally, they support mums with breastfeeding. And they're learning these skills, learning oral skills. So obviously sometimes it's a slow process to develop breastfeeding, and so that support that they get from these infant feeding coordinators is really, really valuable. I work with physiotherapists and occupational therapists, and their role is to implement a variety of strategies to support each baby's development and providing enough nutrition is going to aid their development. So that's where my role fits in with that. And I also work really closely with a speech and language therapist. So their role is to assess the safety of starting oral feeds. So they'll look at how they're sucking on a dummy, for example, so not on milk initially, and see what that suck is like. They'll take into account how much breathing support they need, because they can't often manage to suck, swallow and breathe at the same time. And if they can't coordinate all of those three things, then they're not safe to have oral feeds. So our speech and language therapist is really, really valuable on the unit, and I work very closely with them. And then all of these team members will not only support in the management of the infant while they're on the neonatal unit, but planning their discharge and potentially beyond as well. So a lot of the team that I work with will continue to review these infants once they're home. So what is the outcome for baby G? Well, he's had dietetic input throughout his inpatient stay, and I'm pleased to say that with careful calculation and monitoring, he's met his requirements for growth, and he's now starting to establish oral feeds. His growth chart is looking really good, and he's starting to climb up in terms of his centiles, and we know that that's going to impact on his ability to grow and develop. And getting enough nutrition is going to help his brain grow, his gut grow and mature, and it's also going to help his lungs mature, and it can facilitate his weaning from respiratory support. And we're seeing that he's starting to come down with the amount of support he needs. So actually all the things that we look at are looking really positive for baby G. And I am so pleased that I've been able to be a part of that journey for that baby and for that family, to support them. And I'm really hoping that this input and what I've done is going to impact on his outcome in his later life.
Thank you, Sarah. That's been really insightful. I'll hand you over to Chloe now.
Thank you for that, Sarah. It was so interesting to hear about your role a little bit more. My name is Chloe. I have a very different role to Sarah, but I am still a dietitian. I'm a practice development dietitian, and we'll talk more about what that actually means in a second. And I work at Bedford Hospital. So my career journey so far, so I went through the undergraduate route. So I trained at King's College London and did a 4-year undergraduate degree. And during that degree, I sort of did 3 clinical placements. So one was with a community healthcare trust, one was with a big university teaching hospital, and one was with a smaller district general hospital. I also did a public health placement as well. So I did some work with Age UK in London, and had a look at sort of the nutritional intake of their service users and how we could help them improve that. Once I graduated, I got a Band 5 job at St Thomas's Hospital, and that was a rotational post, which was really exciting because you get to try lots of different things. So involved in that, they were 6 months rotations. So I did 6 months in gastro and 6 months in vascular. And I think coming into that post, I didn't know that you could have such a thing as a vascular dietitian. So that was really exciting for me. And it was all to do with people who had conditions that affected their blood vessels. So lots of diabetes, and patients who had required amputations, for example, and needed extra protein, extra energy for wound healing. So both of those rotations were in the hospital, so were acute rotations. I then moved into a Band 6 position after that in upper GI cancer and surgery. So that involved supporting the nutrition of patients who had cancers from sort of like the stomach upwards, really. And we supported patients post-operatively. So after they'd had surgery to remove the cancer either from their stomach or their esophagus. And that would involve techniques similar to what Sarah mentioned. So sometimes that intravenous nutrition and sometimes that enteral nutrition, so via a tube as well. And then I moved down the GI tract to lower GI cancer and surgery as well. So that was supporting patients with cancer of the bowel, so the intestines. So that was the small bowel and the large bowel. And again, it would be the patients who had undergone surgery. So they'd had parts of their bowel removed and the remaining parts stuck back together, or whether they'd had a stoma formed and supporting their nutrition. And some patients could eat and drink, and it was just supporting that. Some patients required, again, tube feeding. And some whose bowels weren't working as they should do required sort of feeding into their veins to make sure they were getting all the vitamins and minerals and energy and protein that they needed to recover. We also did a home parenteral nutrition clinic, which was where we had patients who were fed into their veins at home as well, and helping them manage that. After that, I moved into a little bit of a different clinical area and went into weight management. So that is supporting people to achieve and sustain a healthy weight if they're overweight, for example. And that was with an NHS health service provider called Aviva. And that was a fully remote post, so I was working from home, so I had to learn lots of different skills because normally I'd be seeing patients face to face. But again, really exciting, and I think it was a really good learning opportunity to develop different skills, so different ways of talking to people and empowering patients as well. And then after that, I did a little bit of locuming, so worked at Luton and Dunstable on the wards, doing sort of general dietetic work. And then I found the job that I'm in now, which is practice development. And we'll talk a little bit more about a day in my life, but practice development essentially supports our dietitians to make sure they've got the skills and the knowledge and are maintaining that through professional development. And it also ensures that we are training up the next generation of dietitians as well, so through apprenticeships and students as well. So it's a really exciting role. I think I was a little bit worried about moving away from the clinical side of things and the patient-facing side of things to the non-patient-facing side of things. But I can say that it was a really, really good change for me. It's really exciting, and there's lots of challenges. And I think it stretches me in a different way to what the patient-facing side did. But I think I'm still very new in this post, as you can see, and so I'm still learning lots. So I couldn't really do a day in the life because every day is completely different. But what my sort of days look like in terms of content and the jobs that I'm doing. So as a practice development dietitian, I am sort of the central point of contact for all of our student placements. So what that means is students who are training at university to become dietitians have to do a certain number of hours in the hospital and out in sort of clinical sites, learning on the job, really, I suppose. And that comes to me to sort of coordinate their timetables, liaise with our different clinical teams to make sure they've got lots of activities and experiences and exposure to make sure that they are meeting their learning objectives. So we work with the university and the students there. I also coordinate our apprenticeships, which is something really new for our trust and really exciting. So that is whereby we sort of recruit someone who works with us as part of our team as a dietetic assistant, but alongside that, they're also sort of going through a dietetic degree as well. So they're learning both on and off the job. So we have two apprentices starting with us soon. So again, that will be new territory for me and lots to learn about, but a really exciting new route into dietetics that's sort of different to the traditional route. I also provide sort of professional and wellbeing support for our newly qualified staff as well. So when our Band 5s join the team, they have something called preceptorship, which is a period of support, really, throughout their first year. And as a preceptor, I'm there to support them with wellbeing, general settling in, and achieving their objectives, really. So that's a really nice part of my job. I'm quite involved in the induction of new staff members and learners, so introducing them to the trust, the department, and their role. And again, so helping staff build competence and confidence, so ensuring that they have got the opportunities, the training to maintain and develop their skills and knowledge, really, to help ensure those high standards of care and practice and make sure that as a department, the service that we're offering to our patients is the best it can be. And we are optimising effectiveness and safety, really. There's a bit there about promoting CPD opportunities. So as dietitians, it's really important that we maintain our skills and knowledge. And that's known as continuing professional development. So in order to stay registered as a dietitian and to keep calling ourselves dietitians and to practice safely and effectively, we need to maintain our training and development throughout the course of our career, which is another really exciting thing about dietetics, because the research and the evidence out there is always changing, so we're always learning. And part of my role is to support our team with that, so share different learning opportunities and facilitating those in-house as well. And another part is work experience placements. So often we support students who are looking to pursue a career in dietetics and want to get some work experience to work out whether that's the career for them. And so we try and get our work experience students to have lots of different opportunities to see the different variety of careers that you can have within dietetics. So there's lots of rewards and challenges. I'd say mainly rewards, but there are obviously, as with any job, some challenges. I think the main rewards for me are being able to make a difference. So supporting our students and our staff to develop their confidence and their competence in their role, and seeing that in action is really quite rewarding and quite fulfilling as well. I really love the fact that this role I can help shape the future of dietetics and raise the profile of dietitians. And we do that through sort of offering training opportunities to student dietitians, through offering new routes into dietetics like apprentices, and raising awareness of the profession. So going to careers events and speaking to students at schools, and also having work experience students in as well. I think one of the biggest things for me was working with people. And I thought that was always something that I was going to miss leaving the clinical side. I really sort of worried about the fact that I wasn't going to have as much patient contact. And whilst I missed the patients, I think I've actually really loved forming strong working relationships with our department and our dietitians and our students. So that's still really rewarding. Some of the challenges, and I think most dietitians would say that there's lots of responsibilities. So you're often sort of spinning many plates. And so trying to manage all of those and prioritise your day and manage your time effectively can be quite hard, especially when you've got a few things to do that day, that week. But I found that sort of speaking to my team and working with my team, and that communication is really key to helping you manage that. And I think people are always really happy to help. And it's great to have a really supportive team. And again, I've put working with people as a reward and as a challenge, because there are lots of different learning styles and different people work differently. So overcoming that can be challenging. But again, I suppose to flip it on its head, it can be really rewarding when you work with someone and you're able to work that out between you, and you feel as though you're able to support them and they're telling you that actually that is really supportive. So it is a challenge, but I think mainly it's a reward once you've overcome the initial barrier. So advice to my younger self, and I think probably very similar to what Sarah said, one of the most important things that I found, or one of the most beneficial things that I found, were the opportunities that were sort of available to me. And I think it's so important to seek out those opportunities, take them on and make the most of every opportunity. And I remember one of my very early line managers said, always say yes and then work out the how afterwards. And that's really stuck with me. And I think now sometimes it can seem like a lot. And I think balancing your well-being and your workload is really, really important. But if it's a good opportunity, grasp it with both hands, because you learn so much through exposing yourself to different situations. And keep asking questions. And I think I'm still asking questions now. And I think I will continue to be throughout my whole career. And I think lots of our students or learners are sometimes worried that they might be asking too many questions, or asking silly questions, or asking the wrong questions. But actually, I don't think those things exist. I think asking the questions is really, really important, and just expanding your knowledge. And it's how we learn. And I think, like I said, we continue to learn, whether you're a student or whether you've been a dietitian for 20, 30 years, because things are constantly changing. And the patients that we see are constantly changing. The people that we interact with are always changing, and there's always new scenarios to learn from. And on that, I suppose, it's keeping an open mind, and that openness and willingness and eagerness to learn as well, and knowing that it's okay to be wrong as long as you can learn from that. And just to look after yourself, because again, I think it's a busy career, it's an exciting career, there's lots going on. And I think being able to prioritize your own health and well-being and being able to balance your work and your home life is really, really important, and seeking out and sort of working out what that looks like for you. So for me, recently it's been running. I never thought I was going to be a runner, and I'm still quite slow, but that's fine. But for me, it's just nice to be outside, away from work, and just sort of having a space and time to sort of clear my head, I suppose. And I think that's really, really important.
Thank you so much, Chloe, for sharing your journey with us as well. It's been really insightful, especially to see the development, I guess, into education as well, sort of like the alternative pathways that you can take. You don't always have to stay clinical. It comes with its new challenges and its new experiences as we go along. But thank you so much, Sarah and Chloe, for taking your time today to share your journeys and your expertise with us. It's been really insightful. I feel like I've learned loads myself, so thank you so much. So to the rest of you, please take your time to tell us what you think. Please use the QR code located on the screen. We really hope you enjoyed today's session as much as I did as well. So please just take a moment to scan the QR code and give us some feedback and any suggestions. Thank you ever so much.